Under the tagline, "We can, I can," the day explores how the global burden of cancer can be reduced. It's all about increasing awareness and understanding and exploring how collectively or individually you can make a difference.
Things that we can change are really quite simple. They don't have to be major and dramatic. You know, move a bit more, a little bit more exercise, eat healthier, reduce our alcohol intake, try and cut down on smoking if we can, or stop it completely. All those little things make a huge difference. But it's not just the changes we can make in our lifestyle, but also being more aware of your body. Notice things that have changed. Notice persistent signs and symptoms. You know, there's little things like that that can make a big difference. And early detection,
absolutely,
early prevention, you know, increases our survivorship skills or survivorship rates. You know, so
absolutely, it's important to go to your GP if there are unexplained symptoms. And also, very importantly, accept that invitation for screening.
But is that message for a healthier lifestyle actually having an impact? I mean, when we consider figures here show that smoking rates are one of the highest in Europe and obesity is also a problem?
I think we all have an individual responsibility to look after our own health. And sometimes we develop our bad habits and it's really hard. It's really hard to beat them. You know, if you are a smoker, it's hard to give up. So our job as Cancer Charities and as organisations is to try and support people with those difficult choices, with changing lifestyles. And, you know, it's statistically proven it takes about 30 days to really change a habit. So if we can support people in changing that habit, it will do a massive thing, not only to their health, but to the health of the population in general.
There are numerous initiatives both the GHA and charities are working on, looking ahead to the Recall cervical screening programme, which will be introduced later this year. The GHA's Cancer Services Coordinator also reveals that the issue of cancer in the workplace is being addressed.
Under the Equal Opportunities Act of 2006, cancer patients do have rights, and we just want to perhaps give some guidance to employers and employees on how they can best be looked after and supported when they go through a difficult time.
And that comes back from listening to the charities as well, because that's something that we hear a lot when our patients and our clients come up to us and we support, is that uncertainty of what their rights are from the workplace and time off for chemotherapy and treatment. So that's a really positive influence and positive effect.
The message for tomorrow is simple: to get as many people as possible around the globe to talk about cancer.
Come down, meet us all. You know, it's a great day. It's this year as well. We're not only talking about education and better understanding. We're also doing a big thanks to everybody that supports us throughout the year. So we want to focus on that as well. We're going to have pictures of people who've done fundraising for us over 2016, and that's a big, massive thing, because without people fundraising, without people actually giving up their time and doing these crazy things that they do to raise money, and the community who are fantastic at supporting us all. Without that, we wouldn't be able to make the forwardness that we're doing at the moment in cancer care in Gibraltar.
The initiative will be marked from the Piazza tomorrow as from 10.